see. The preganglionic fiber releases what? Acetylcholine. Acetylcholine. The nerve fibers over the adrenal medulla release what? Acetylcholine. Acetylcholine. The receptors present, what is the largest ganglion? Autonomic ganglion. That is adrenal medulla. Adrenal medulla is a ganglion. So the fibers on the adrenal medulla is also preganglionic fiber, and that release acetylcholine. The sweat receptors, they are having sympathetic fibers, but they release acetylcholine. The muscles are having acetylcholine, but which receptors? Nicotinic receptors. Remember that, not muscarinic. These are other MCQ. Now the clinically GFR is measured by creatinine clearance. The most accurate way of measuring GFR is inulin clearance, but that is not clinically possible. That is in laboratory. The most accurate method is inulin, but clinically by creatinine clearance. And if you want to find out the blood flow to the kidney, what will you use? PAH, para-aminohipporic acid. These are three different MCQs that are repeatedly come in the exam. During second week test for typhoid, you have to remember Bipasha Basu, BASU. Bipasha Basu, this is an Indian actress. So B for blood, this is for first week, second week, third week and fourth week. For first week, this is blood culture. For second, that is agglutination, that is Vidal test. For S, stool culture, S for third week stool culture, U for urine culture, fourth week. And if the question, so over here the option correct is second week, so the agglutination. So the answer is A, Vidal plus blood culture, because the Vidal is not, they have given separately. If the question asks which test has high sensitivity and specificity, the answer is bone marrow culture. What is the sensitivity of blood culture in typhoid? 50 to 70%. And what is sensitivity of stool culture in typhoid? 30%. Stilbestrol in first trimester pregnancy, what will happen to the female infant later on in her life? Clear cell carcinoma of vagina. This is the from the up-to-date USMLE, and there are researches on that. There are studies on that actually. Clear cell carcinoma of vagina. Coming next, glucose transports across cell membrane is directly proportional to concentration gradient. Facilitated diffusion, because they use the GLUT transporter. Facilitated diffusion. About bar bodies, well, I have made another separate video on this, and I have explained earlier in my earlier lecture, that is the false about bar bodies, not true. The question is true about bar bodies, except this is actually MRCOG part first MCQ. So the option is A, always inactive. It is not always inactive. A portion of it is active. It is other option are correct. A heterochromatin have X chromosome. It can be seen under light microscope. Hormonal therapy causes again the repetition apoptosis. In neonate, the spinal cord terminates at the level of L3. Well, there is a book by the name of Pediatric Surgery. This is written by a UK author, and in that they have given the L3, and I am giving you the reference of that. So this is that book. Clear cut, the option is L3. In the newborn, the spinal cord terminates at around L3. This is L3. In adults, it ends at the lower border of L1 and at the upper border of L2. So L3 for this. straightforward MCQ. Turner syndrome, this is 45X0, not 46X0, not 47X0. One chromosome is out, so that is 45X0. Coming next. Now over here they have did a little trick. Now if you see 46XX0 seems to be correct for Klinefelter's, but that is actually 47XXY. One Y chromosome is added, so that is not the right answer. The right answer is something else. Coming toward next page, the right answer is this one, 47XYY. Although it is seen in 10% of the total Klinefelter's population, but 46XXY, that is not the right option. That is 47XXY. If that is not in the option, then 47XYY. Which antibiotic safe in pregnancy? Now the augmentin and coamoxiclav and nitrofurantine, they all are safe during pregnancy. So look for the word except in exam, and do not utilize it from here. You have to open your mind so that you don't miss an MCQ. So during 8th month of pregnancy, augmentin is the safest drug, while coamoxiclav is the same thing. Nitrofurantine is not actually safe during delivery or near delivery. So augmentin and coamoxiclav. So out of augmentin and coamoxiclav, choose augmentin. Coming next, amniocentesis versus transcervical chorioneculus sampling before 14 weeks. So I will come later to this MCQ. Amniocentesis done and the baby is hit at -2 station. The needle will pierce anterior fontanelle, posterior or sagittal suture. So I think the posterior fontanelle is the right option because the baby is in, the head is like this and the posterior is closer. After 48 hours starvation, that is the fats. 45-year-old male presented with hirsutism on the body and is shy to show her hands to a physician. Now there is a concept regarding this MCQ. Focus. Now she is shy to show her hands. It means she is having hair, excessive hair on her hands. You have to focus on hands in exam. If there is no word mention hands on exam, then choose polycystic ovaries. But if she is shy to show her hand because of excessive hair, so out of the 4 options, the answer is drug induced. Option D. Now I give you the reason why. Because in A, B, C, there is increase in androgens, and the increase in androgen causes increase in hair growth on androgen sensitive area. Androgen sensitive area mean those areas which have androgen receptors. These areas include the upper lip, the beard, moustaches, the beard, the upper chest, and the pubic area, and the armpit. These are the androgen sensitive areas. So what is the most common cause of hirsutism? Polycystic ovarian disease. But the hair growth will be on these areas, androgen sensitive area. But if the question says there is a hair on the hand, excessive hair on the hand, the answer is drug induced, because the drug, the phenytoin, that is actually a prototype for this scenario, that causes excessive hair growth all over the body, or minoxidil. So these causes excessive hair growth, and that is drug induced. But keep in mind, you have to look at the full statement in exam. Hands is mentioned or not, androgen sensitive versus non-androgen sensitive. Which tumor is derived from all the 3 germ layer? Teratoma. Straightforward. 20% patient received hormone replacement therapy and 40% not. The best way to present such a pie chart. That is the right answer. So coming next, least site of tumor mets is spleen, liver, breast and lungs, they are the most commonly involved. And there is another MCQ, they have given you the CA. So it will first metastasize to lymph node, not the liver. Keep in mind, the first site of Mets is the lymph nodes. From the lymph nodes it goes then toward the other sites. The enzyme most sensitive to the damage of heart muscle after MI is, now you have to focus on the word marker versus enzyme, because myoglobin is not enzyme, it is marker. So if they ask about so coming toward these scenarios, a patient is having chest pain during the first 6 hours. What is the best initial step? What is the best modality? ECG or tropi? The answer is ECG. So which of the following is having high sensitivity and specificity? Tropi. Which of the following is having high sensitivity? Tropi. Which of the following is high specificity? Tropi. Tropi is superior. Which of the following is used in renal failure? Tropi. If tropi is not mentioned, then the next best option is trop T. Most sensitive after tropi is trop T. But if the question says during initial hour of MI, now we are clear, during initial hours of MI, the tropi and trop T will be negative because it takes 4 to 6 hours to rise. During initial hour, the first enzyme that will raise is CKMB, that is enzyme. If the question says during initial hour, the first marker which is most sensitive, but not specific, the answer is myoglobin. This is not enzyme, this is the marker. You have to clear your concept regarding this between enzyme and marker, and they will confuse you. During initial hours, marker most sensitive but not specific, that is myoglobin. During initial hour, most specific and most sensitive enzyme, that is CKMB. At 4 to 6 hour, most sensitive and specific is tropi. In renal failure, that is again what? Tropi. During initial hour, what is the best investigation? That is ECG. During initial hour, what is the best biochemical marker? That is CKMB. But if the question asked during initial hour, what is the best sensitive marker that has low specificity? Then myoglobin. So you have to clear your concept regarding that. Regarding amniocentesis, risk increases of talipes if performed before 14 weeks. Yes, the risk is increased. Which of the following is associated with hematoma? Now this is the totally benign condition. Hematoma is a totally benign condition. A man died 5 days after MI and large blood clots were found in the pericardial sac. He died due to pericardial tamponade. There was ventricular rupture. When there was ventricular rupture, what happens? Blood comes into the pericardial sac and that compresses the heart, tamponade. And there is a table in the first aid, and usually 1 or 2 MCQ come from that, and they have given along with the time during first 24 hours what happened and what is the most common cause of death. After 24 to 3 days, what is the most common cause of death and what will you see on biopsy? After 3 to 24 days, what will you see on biopsy and what is the most common cause of death? And after 24 days, you have to memorize that. Right adrenal vein drains into the inferior vena cava. Left drains into left renal vein. A patient taking oral contraceptive pills and antituberculous drugs and got pregnant. The drug responsible is, this is rifampicin, this is not isoniazid. Rifampicin increases the metabolism of oral contraceptive pills. If it increases the metabolism of, it is actually enzyme inducer. So if it is enzyme inducer, it increases the metabolism of oral contraceptive pills. So what it causes? It causes contraception failure. So you have to increase the dose of OCPs. The answer over here is option B is right. Case about the odds ratio was given, we had to calculate the odds ratio. Now regarding the odds ratio, well, they have given you the value, but this is a poor recall. But you have to clear your concept regarding the odds ratio. I will make another video, I think, and I will continue with the, so 2 MCQ I have to discuss later, and for the rest I'm go quickly through them. So the criteria for screening test and diagnosis of cancer is, option C is right, it should be acceptable. Early diagnosis cures early, but if it is not acceptable to the general population, what will you do if the person is not ready to do the test? If, for example, I am giving you a hypothetical example, if you choose the DRE as a screening test for prostate cancer, but 95% of your population is not acceptable, they do not accept this, although it may you have keep this criteria that it reduces the mortality because you are having early diagnosis, but if the population is not ready to go through it and they are not comfortable with it, so that is not the right option. It should be acceptable to general population. Which are the following causes least respiratory depression? Ketamine is the right option over here. Ketamine. 20-year-old man has dyspnea on lying down. The structure most likely cause this is actually retrosternal goiter pressing on the trachea, and they usually present with the stridor. Now this is very important MCQ. The cause of RBC fragility. Now if they ask about the RBC, osmotic fragility is something else. You put the RBC in a solution, in a concentrated solution, and you normally the RBC is having increased surface area. There is a biconcave disc and there is surface area is increased. But if you are having a spherical RBC and you put that in a hypertonic solution, what happen? They burst. So normal RBC have increased surface area that is stored inside the biconcave disc. So if you put in the hypertonic solution, what will happen? It will comes out from it, the concave disc will become spherical. But if you already have deficient surface area and you put that cell in the hypertonic solution, so what will happen? That is not having that reservoir, that will burst out. If asked about the osmotic fragility, then the answer will be hereditary spherocytosis, and in that you are having deficiency in structural protein, that is NK-RN and spectrin. But over here this is enzyme deficiency, G6PD deficiency, that causes what? Denaturation of hemoglobin, and that are called Heinz bodies. So the Heinz bodies are seen in the G6PD deficiency, and then the spleen removes those areas, and then the spleen removes those areas. They are called bite cells. There is another thing for that, Howell-Joel bodies. These are actually the remnants of DNA in the RBC, usually cleared by spleen. So they are seen after splenectomy, or they are seen in which disease? Sickle cell disease, because in sickle cell disease there is splenectomy. There is spontaneous splenectomy, that is, there is thrombosis of the splenic artery and the spleen disappears due to decreased blood supply. So over here, so Howell-Joel bodies after splenectomy, and Heinz bodies G6PD deficiency, and bite cell seen on peripheral smear. Microtubules are present in centrioles. Bronchopulmonary segment each has its own blood supply. Option A is the right answer. Different number on both sides. There are same number on both sides, but there is actually fusion on one side. So A is more right. most effective gluconeogenesis from, that is protein. And which protein? Mainly glutamic acid. There are other proteins also. There is a alanine, you have to remember that, but over here the option is protein. So coming next, again this we discussed in detail. Increase in the interstitial fluid pressure, N. Decrease in capillary permeability, no. Increase in colloid increases capillary permeability. Option D is the right answer, because if you are having increase in capillary permeability, what happens? There will be leakage of protein. Increase in interstitial, the MCQ is increase in interstitial fluid pressure. So if there is a increase in capillary permeability, what happens? The proteins, they leaks from the vessel into the interstitium, and that draws the water and actually causes edema, and actually it increases the interstitial fluid pressure. What is this? 30-year-old female presented with secondary amenorrhea diagnosis of premature ovarian failure, ultrasonography being normal, most likely causes. We'll discuss this scenario separately. So we are left with the three scenarios that I will make another video on that. This is the third one. Clear cut scenario, the G6PD deficiency. Patient has used anti-malarial one day back, and this is G6PD deficiency. If the question does not mention about the anti-malarial, the answer will be black water fever, falciparum malaria. True about glycolysis, the option B is right. A person naked with 80% humidity in room, the mode of loss of heat from the body is by radiation, and conduction is the right answer.